Welcome to AETCM. Today we are going to discuss about various types of masks. So I have three masks with me. One is a surgical mask, one is a 3-layer mask, and one is an N95 mask. There are many more masks like a mask made of clothes, sponges, etc. And there are masks other than this N95 mask. There are N95 mask and N99 mask with and without respirators. So all these masks are flammable, biocompatible, and they can prevent from particulate matter penetration. But the filtration to organism varies depending upon the mask. So first we will discuss about the surgical mask and the 3-layer mask. So this is the surgical mask and this is the 3-layer mask. This is surgical mask, this is 3-layer mask. Both look similar actually. The surgical mask, there are 2 layers. Both the layers are made of polypropylene. In the front it is 20 GSM made by spun-bound technique, and the inner portion, which is comparatively lighter to that of the outer portion, is 25 GSM made by melt-bound technique. And the 3-layer mask is having both these layers, and in between both these layers there is an oilophobic layer. So the filtration for both surgical mask and 3-layer mask is for 3 microns, and it is ideally used during some surgical dental procedures, or it can be used if the medical professional is sick, or if it can be given to patients who are sick to prevent others getting infected. Like if the patient is having any fever, cough, sneezing and all, it can be given to the patient to prevent others getting infected, and it can be used during the procedure. And then it can be used if you are going to an infected ward. The concerned medical person can use this mask to prevent touching the face. During this corona season, we advise not to touch the face, so this mask can prevent us from touching the face. Okay, so how to use this mask? Before using the mask, ideally wear a gloves, properly sanitize your hand, either wash with soap and water or use a alcohol based solution, and take the mask, check both the sides, identify the outer layer and the inner layer, and identify the metallic clip. There is a metallic clip on the top and elastic bands. In some masks it will be just elastic ties. This is plastic ties. So this is metallic. There is a metallic clip. The outer part is comparatively darker with respect to the inner portion, and the metallic clip part is the upper part. So first make a thorough hand rub and then put the mask on the face. Before that, you have to check for any damages are there, whether the ties are proper or not. Then first press it on your nose, mold it to the size of your nose, and then tie the mask at the crown. And the mask should ideally be above the ears. So the upper part of the upper tie is above my ears, and the lower part should come behind the ear. Before tying, make sure that the chin is covered and all the sides are tight. Okay. And just check, exhale sharply and check whether air is leaking somewhere, and if at all air is leaking, just tie the mask some more tightly. But there are some disadvantages. Even though we use this mask, there is still chance of leaking the exhaled air outside and infecting other patients. This mask is having a pore size of 3 microns. The disadvantage of this mask is it cannot prevent the leak from the sides and the lower portion completely, and it can be used by medical caretakers and patient's own bystanders, but it doesn't prevent the bystanders or the patient caretakers from getting infected. It can only be used by the patient, or if at all the medical professional is sick, to prevent others getting infected. It itself cannot protect the person who is wearing the mask from getting infected. If at all you accidentally touch the mask on the front portion of the mask, immediately go and wash your hands with soap and water or alcohol based solution. This mask is ideally can be used only during the procedure or maximum 4 hours, and then you have to discard this mask. It is not reusable. So how to remove this mask? So ideally first we have to remove the lower tie of the mask. First remove the lower tie and then remove the upper tie. And put it in a closed bin. Do not reuse this mask again. So now we will discuss about the N95 mask. So this is an N95 mask. N95 mask other than the 2 layers. Now we will discuss about N95 mask. This is an N95 mask. It is having 3 layers. One is an activated carbon layer, polypropylene layer, another one is an oilophobic layer, and it is having a pore size of 0.3 microns. And all N95 mask will be having a NIOSH number in front. And which all are the parts of the N95 mask? This is the mask area. There is an metallic band here to mold to the face, to the shape of the nose, and there are elastic bands. The major disadvantage of this mask is ideally made for adults and there are no kid size available for this mask, and this mask actually can protect you from getting infected from either splashes or from secretions. Okay, so how to wear this mask? Before wearing this mask, just check the parts of the mask whether there is a metallic clip and it should come on the top, and whether the bands are correct, and check if it is having any damages. Then before using the mask, make a proper hand wash or use an alcohol based solution to clean your hands, and then hold the mask. So how to hold this mask? First hold the mask on your palm, so that the elastic bands lie below your palm. Okay, and then keep it on your face like this, and then first select the lower tie and then tie it on the neck below the ear. So it is coming at the neck level below the ear, and then take the upper tie and place it on the crown, and it should come above the ear, and then after that straighten all the ties. This might be a bit twisted, so straighten the tie if you have a long hair, both the ties should be above and below the hair, and then make the lower tie straight, and then check the sides of the mask whether there is any leak or not, and then place your hand on the mask and then exhale sharply and just check for any leak for the mask. And this mask ideally can be used for 4 hours if you are going to see a infected patient, or if at all you are using on a daily basis, you can use a maximum up to 8 hours. And this mask is actually reusable. You should store it in a closed bag or in a Ziploc. If you are storing it in a Ziploc, then it can be reused. Or if you are planning to discard this mask, before discarding this mask, make a proper hand wash, then remove this mask. So how to remove this mask? We will see the steps of removing the mask. First remove the lower part. Before removing the mask, make a proper hand wash. Then first remove the lower tie. Remember not to touch the front portion of the mask, because that portion is exposed and that might be infected. If at all your hand accidentally touches your front portion, immediately go and wash your hands or use a hand rub. Then remove the upper tie. like this, so that the exposed portion is outside, and then discard it in a closed bin or store it in a closed ziploc. After removing the mask, make a thorough hand rub or wash your hands with soap and water. Remember, mask alone cannot prevent you from getting infected. You should properly wash your hands and use appropriate protective measures to prevent you from getting infected. Thank you.